Greetings, Bill Mobley for the Sanford Institute for Empathy and Compassion. And this is the Compassion Forum, where we take an opportunity to talk with people that are playing a very important role in our lives at UC San Diego. And one of those people is Patty Maysent, who's CEO of the UC San Diego Health System. Patty has soldiered through this very difficult time in an amazing way. I've been told she's working 26 hours a day. We really admire her. Patty, many people will know your name, but perhaps not the person. So could you tell us a little bit about yourself, your background, and those experiences that you had that led you to the position of CEO?
So I think the two most important things to know about me from my growing up is that I grew up in Oakland, and my father was a politician. He was a city council member in Oakland, and I really learned from him because he was the master of it, of bringing people together to get things done. He was someone that would get things done, and anyone that was interested in trying to make change happen for the better of the community, he would bring them together, and that's been an important lesson for me that I've tried to role model. And the second thing is that I was a swimmer, and I swam. My career was primarily in the late 70s when the East Germans had just defeated the American women in the 1976 Olympics. Of course, they were taking steroids at the time, but what it meant for U.S. swimming at the time is that we began to train in a way that we knew that when we got up on the blocks, no one had trained harder than we had. So for me, I trained 6 hours a day, even in high school. So I did 13 workouts a week.
Wow.
And the reason I highlight this is because a lot of times when things get really tough and they say, how do you have the stamina, or how do you have the persistence to continue on? And I tell people, because I'm a swimmer, and we just knew how to push through just about everything. And so I lean back on that experience quite a bit in how I live my life in general. Always 110%, and always working with a hard work ethic that I learned from doing that. So I went to graduate school at UCLA. I was an undergraduate at Stanford. I swam there. I swam on the U.S. team. I experienced the Olympic boycott. I was actually the national champion the year before the Moscow Olympics in 1980. We were national champions at Stanford in swimming. But we did boycott the Olympics, and that had a big effect on me because I went into my undergraduate experience thinking that I would be a physician, and made some different decisions after the boycott, and ended up with a human biology degree, but with a focus on business. And I didn't know then that I don't know how it happened, honestly, serendipity that I ended up with the path I did. I took 2 years before going back to graduate school, and then entered into the hospital track. There was a small hospital track in the School of Public Health at UCLA. It took 10 people every year, and it was very focused on becoming a hospital administrator. As I said before, I didn't really want to do any other kind of work. I wanted to do something that was meaningful to people. And then got my MBA there as well, and started my career in healthcare and in hospitals, and have never looked back. I became a CEO at St. Jude Medical Center in Fullerton when I was 32. So I was, I think, the youngest CEO in Orange County, and I think I was the only female CEO in Orange County at the time. So that was a great experience. I made a decision when I had children to resign from that position because, as I said, I'm kind of an all-in kind of person, and I couldn't imagine how I could run a hospital and raise my children, and I really wanted to have that experience of raising my children myself, mostly, and so. But that entire time that I had this wonderful mentor, Paul Viviano, who was the CEO at UCSD before me. I worked with him for 30 years, and he created this wonderful opportunity for me that no matter how much I was taking care of my kids, I could always work. And I could always work at least 10 hours a week. There were times, when they were really young, I maybe worked 10 hours a week. And other times when they were getting older, I could work 30 hours a week. But I was always in the C-suite. I was never outside that senior level experience and helping guide as he moved on his career, helping to support his work. And then again, creating the opportunity for me at San Diego to become the CEO here once he moved on to a different position. So I've had a really, really fortunate career. And the one thing I'll say about my experience being mentored by Paul, and I think it fits really nicely in where the Stanford Institute is going, is that it wasn't just that I was mentored, but I was, sponsored by him. And what I mean by that is he looked for every opportunity for me to grow in my career. And early on, I was not, I'll give you an example, I was not a very good public speaker. And he put me out there, and he lived through some painful presentations that I gave to boards. If I had watched one of my direct reports give some of those presentations, I'm not sure I would have put him back out there again, but he kept putting me back out there till I got good at it. And, it's a rare event, but something I think we need to look for as leaders and also for people who are trying to grow in their career, is someone who really help them take risks with them and give them opportunities to grow.
It's an interesting, hearing the story, it's a great story. It's an interesting mix of really pro-social commitment, incredible diligence and discipline, building resilience, benefiting from mentors like Paul. We remember Paul well, we loved him. And so in every way, you've kind of pulled those threads together to make this really beautiful cloth of, the CEO, care for this place, support this place. I pull people together, we have conversations, and we move forward. And so, Patty, we thank you for that. Let me ask now, so it was difficult enough to be CEO of this hospital system before the pandemic. What new challenges have you faced, and how have you dealt with those?
It's interesting. It's always an opportunity to really get focused. And I think one of it's similar to when we managed through a strike, how quickly the team coalesces. We set up an incident command center. We moved to daily huddles, meaning, we have all of our huddles running through the organization, and it boils up to us every single day. We work through work processes through the command center. And we have just some really incredible health system leaders in our organization that have had a lot of experience in managing the command center. And so what's interesting about it, as hard as it is, we're really singularly focused right now on it. And it coalesces the whole team. Everybody's working well together. There's no other agendas going on. Everybody's focused. And so we're changing things every single day. We're making process changes, and we're making decisions and all. And so I think that's the beautiful part of what may or may not be seen, which is this incredible team coming together. I've seen faculty leaders over the last month and a half emerge. It blows me away how good they are. Really, really amazing. Jess Mandel, Randy Taplitz, Francesca Toriani, Mike McHale. I mean, the list goes on, but Ruth Waterman. I mean, I hate to say names because I'll miss people, but just seeing our physician leaders also coalesce together with us and help us work through this. Dr. Mandel has set up the the surge plan, we needed to create 40% capacity in the health system for COVID patients.
Mm-hmm.
So we had to shut down all of our engines and then create that capacity for critical care, and to have leaders like that help us do that has been pretty amazing. So I feel really good about those processes. We've had amazing leadership in the lab. And so we're testing an incredible amount of people right now, both patients. We've launched last week a testing of our healthcare workers, which is really fascinating. I'll talk about that if you're interested in a minute. And so PPE, because we were so what happened at the very beginning of this pandemic, when Wuhan was on fire and the 2 planes of Americans were coming back from Wuhan to Miramar, I got a call from the county, and they said these planes are coming and we don't know what it's all going to mean, but we need a hospital system to be a place to care for patients if needed. And they said we've called around to the other systems, and I said no, absolutely it has to be here. We have to take those patients. We're the ones that have the depth in infectious disease. We're the ones that have the infrastructure, the command center, et cetera. And so we took those patients early on. And because of that, I think we got ahead of the game in terms of getting testing going and making sure we had the protective equipment that we needed. So it's situated us really nicely.
When I listen to the town hall, as other people do, it's very clear what you're saying. There are people around that table that have done amazing work. And in a way, I think our system is really kind of a model, could serve as a model for others. Not that other people don't have great ideas, but I think this cohesion of effort is really pretty striking. And so that leads to the question, we're in the middle of this thing. We're not done yet. We're adjusting. We're hoping to recover here. But, there are things that are yet to be done. What do you think? Not only what have we learned about this sort of latent leadership that's just waiting to be engaged, but are there innovations that now present themselves that make us stronger going forward?
It's a great question. And again, that's the silver lining of the pandemic, is some of the innovations that have come out and will come out. The biggest was probably televisits. So, we had the capability of doing televisits for quite a long time. And I think over a 3-year period of time, we'd done about 1,000 visits. And overnight, last month, over the course of about 4 days, we drove such incredible change at those video visits. We did 1,000, I think 1,200 the next day. So we went from 1,000 over 3 years to 1,200 in one day. And with a lot of acceptance of that change, it was a new thing. It was a struggle. But one of the things that the pandemic has allowed us to do is to drive new change and innovation. And so what does it mean? I'll tell you honestly, I was really concerned about telecommuting for some of our teams. So I'll pick one in particular, our RevCycle team. But because of the way that the orders were written, they were put in a position to telecommute. But because we've set up systems, they're more productive than ever. And our metric in that area, days in AR, are coming down. And it's amazing how much people have adapted to doing work from home. And then that carries through to, okay, well, what does that mean? How much facility do we need going forward? And how do we rethink about our spaces to accommodate that? So there's a lot of redesign opportunities here, for sure. And that's where I think the innovation is going to come.
I'm reminded of the cohesion that I see in the really careful planning. I think people should know, our staff, our doctors, our students, our administrators, but also our patients, that we're doing the right stuff. We're doing all the things that make it possible for those people going forward to know that when they come to us, They're going to be safe. Everybody's going to be safe because we're putting in place those kinds of efforts and the testing that's really necessary to say you can come here and you don't need to worry that as a result of coming here, you're going to get sick. I mean, say a word about that, if you will.
Yeah, I mean, it's been a huge focus for us, and I'll highlight two elements of it. The first that you speak to is the testing. And so because we've created capacity, our pathology and lab leadership have been amazing in this process. And we, got testing up rapidly, and we have scale there. We can do over 1,000. We can almost do 1,500 tests a day now. And so the first thing we did was started testing because we had so much unease. I mean, that's the one thing I should highlight is there's a lot of fear and anxiety in the health system right now. And so our surgeons, our anesthesiologists, our staff doing surgical procedures, there was just a lot of concern. So as soon as we had the capacity, we started testing all of our patients the day before they came in for surgery. And the results are really interesting. So we've tested over 700, I think over 750 pre-op patients. And of those, 0 had the virus except for one that had symptoms of COVID that we knew about. And they did test positive. Everybody else was negative. And that is an amazing statistic. And then the next thing we did was we started rolling out testing for our healthcare workers, and we started in the emergency department. And so there we tested everyone from EVS up to, nurses and physicians, tested over 600 in that environment, and only one of the 600 plus was positive. So it gives us a sense of, I think, a lot of optimism and a sense of safety in our environment. So the idea of using testing and being able to communicate to the community that they're safe coming into our environment is really important. And the other thing, so the one that was positive, just to think about that for a minute, why did the asymptomatic positive healthcare worker, why wasn't there an outbreak around that individual in the emergency department? And the answer to that question is because of our masking policy.
Right.
Even though they're asymptomatic, maybe not shedding, that's beyond my domain expertise. But they're wearing a mask, the patients are wearing a mask, and people are still safe. So we are a safe zone, I think, and we're going to continue to test. We're going to move to Moore's Cancer Center. We're testing the ICU workers, and we're going to see what our population really looks like, and then we'll make some adjustments from there. But it gives us a lot of confidence in terms of reopening services that we're bringing patients into a safe environment.
Yeah, and it's a wonderful message to send that, you're safe with us is essentially the message that we can send to not only to those who work with us, but our patients. Patty, what can we do to help you?
I think it's a great question. I love the community support for our healthcare workers. I think we've received food donations. Dr. Mendel, the critical care team, make jokes about they're getting heavier as a result of this because there's so much food coming into the system. But I think the support of the campus and the community around our healthcare workers is really it's just really meaningful. I don't know if you heard the letter that I read yesterday from the 12-year-old.
I did.
About our healthcare workers being superheroes, and it's just it's just meaningful to, I think, our teams to know that they're loved and they're supported, and people are praying for them every day. So I think that's that's one of the biggest things. The other is just to let the community know that it's safe to get care.
Yeah. And
I think we all have to have that message. It's safe to come in and get care. What we're seeing is that patients aren't coming in. They get heart attacks, strokes, like really serious things, and they're not coming in for care. And that just breaks my heart because they need care, and it's safe to come in. I go in the hospital every day. I don't worry 1 second about that. I'm much more concerned about getting the virus going to the grocery store than I am going to work.
Right. Patty, what a great message, and what a great leadership role you're playing. We know that you and our chancellor and our vice chancellors and Steve Garfin, our dean, you're all doing a terrific job. We appreciate it so much. And we're on your team. We're on your team, and we thank you for this interview. Thanks so much.
We're all a team.
Take care. Thanks so much.
Thank you.
Bye-bye.
All right. Thank you.